Ladies and gentlemen, it is a great honor for me to close these first MSF Pediatric Days. So it's been 2 very interesting days. Myself, I've been able to participate and be here for today. And I feel really happy to have had the opportunity to be part of it for several reasons. I think that, firstly, I'm really pleased to see that an initiative from the MSF Association can grow to such success. As a member-driven organization, MSF provides the space for field workers to translate the challenges that they've faced in the field into solutions. And this is a great example of that. Further, it is a very strong engagement for pediatrics in the Swedish section of MSF, so we are big supporters of this work. On a more personal note, I've also seen the great need for good pediatric capacity and responses in the field. Before joining MSF, I worked with humanitarian law, human rights, and also child protection. And I've met or been forced to refer quite a few children on numerous occasions to MSF facilities in conflict settings. And it is really a big need out there for good quality pediatrics. Also, of course, globally, Sweden is a country at the forefront of pediatrics, and the pediatric network that exists in Sweden can also be very useful for MSF. I believe that there will be a before and an after. Who joined those first pediatric days in Stockholm? We will be those people that did that. And I think it's not only for, of course, the high-level presentations that were made in this room, but also for everything else that happened outside, in the corridors, in the evening, in the coffee breaks, all the networking, all the discussions that you had among yourselves in creating, sharing experiences, creating networks, and discussing with each other. Several conclusions of today have already been given by experts in the field of pediatrics, and I will not need or even dare to do this myself. My reflection is more that many of the issues that have been brought up are things that I've seen are very pertinent and translates well to the needs in the field of MSF. I was quite recently in the Central African Republic and also in South Sudan. And in those very resource-limited settings, I saw the needs that you've actually discussed today. And that is very encouraging, that it's also been discussions very relevant to what the needs are for the patients out there. I think another reflection has already been touched upon by some of the other speakers, and that is the need in the field that I saw of actually it being teamwork. A patient, a child, is not going to be well supported or well treated if you don't have a team where you have both the doctors and the nurses, midwives, and the mothers and extended family or close family to support it. So the Pediatric Days held here in Stockholm is part of a bigger picture. MSF is an organization that have pushed boundaries and strived for innovation for more than 40 years. We've been pushing boundaries both in regards to where we choose to work, our modus operandi, as well as our medical action. Example of that has also already been mentioned. How we worked with HIV care in rural areas is a well-known example. And when we started to do this in Southern Africa, it was not something that a lot of people believed would work. Another example is when MSF piloted home-based care for severely malnourished children 15 years ago. Instead of being hospitalized in big nutrition centers, they were given ready-to-use food at home in their normal environment. And the results showed better outcomes for the children and enabled for MSF and other humanitarian actors to scale up activities and provide treatment for many more children, and many more lives could be saved, such as in the nutritional crisis, for example, in the Sahel and in the Horn of Africa. The even bigger picture that goes beyond MSF is that today healthcare is under attack. In Syria, in Yemen, in South Sudan, Central African Republic, you see it in many other places as well. The structures that are lifeline and supposed to endure special protection according to international humanitarian law are far from safe havens. This was terribly felt by MSF in Kunduz, in Afghanistan, on October 3rd last year, when US military, during a 30-minute-long airstrike, destroyed MSF's trauma hospital. It was again felt the same month, on October 26th, when a Saudi-led coalition airstrike hit an MSF hospital in Haidan, in the north of Yemen, leaving at least 200,000 people without life-saving care. It is felt on a daily basis in Syria and Yemen, even today. And we need to remember that attacks on MSF facilities provide only a glimpse into the brutality of war. Attacks on hospitals and clinics, schools, markets, houses of worship, etc., are routine in, for example, Syria today. And local health workers bear the brunt of these abuses. And of course, many of the victims are children. But MSF does not give up. We will do everything we can to continue to provide healthcare in the places in the world that many others are giving up on. We will continue to renew ourselves, find innovative methods, partnerships, and keep up the ambition to always become better at what we do, and with our principles of impartiality, independence, and neutrality in our minds. AMR is another topic that has already been mentioned, and I just wanted to also say that, of course, you've already heard that AMR is an increasing threat to children, and in particular newborns. And as Mercedes said, for the 4th time ever, a medical topic was on the agenda during the United Nations General Assembly in New York. And the fact that the world leaders meet on the highest level to mobilize political will to tackle the global AMR is important. But what is really important is what happens afterwards. That is what counts, and that is where MSF needs to continue to push for AMR and the important work that needs to be done on this. So MSF will continue to see human beings before politics and defend the medical mission when healthcare is under attack. We will also continue to protest against political decisions and policies that are harmful to our patients, which causes suffering and death. We will continue to push medical agendas, may it be for access to medicine, to quality care, or when it comes to humanitarian pediatrics. I believe that these pediatric days has the potential to be a platform to push agendas both inside and outside MSF, so that we in the future will be even better at what we do in addressing health needs of children and providing quality pediatric health care in the places we work around the world. And MSF Sweden, we are very happy to support and contribute to this also going forward. Days like this, these do not happen without great effort. A few people have already been thanked, but I will repeat that. And I would like to start by saying a big thank you to Karolinska sjukhuset and Astrid Lindgrens barnsjukhus, represented by Dr. Svante Norgren. Yeah. On the very important technical, logistical side, I would like to extend big thanks to the technical support from Darja and the sound technician Kjell, as well as, of course, the extremely important interpreters Catherine and Emmanuel. I would like to say a big thank you to the MSF Pediatric Days Steering Committee, represented by Stéphane Duyon in Dakar, hopefully still able to stream this session. Thank you very much to Stéphane. Dr. Daniel Martinez. And the head of field HR at MSF Sweden, Jean-Christophe Dolé. And of course, all the colleagues from the scientific committee represented by Dr. Laurent Ifner. Yes. And the colleagues of the organization committee represented by Eugène. And of course, the many office colleagues and volunteers of the MSF Sweden office. And again, a big thanks to Dr. Kristina Elving, our chair for the 2 days. And of course, Matilda. She's been the coordinator, and it's been really invaluable, the efforts that you've made to make these days work and be a success. So hereby, I am very proud and humbled to be standing here in front of a crowd so knowledgeable and so engaged in the field of humanitarian pediatrics. And I hereby have the honor to close the first ever MSF Pediatric Days in Stockholm in 2016. Thank you.